welcome back to Doctor Behind the Scenes, and this video is super special because I'm gonna tell you about my sources that I use for FMG preparation where I scored 215 marks, and I hope that my sources help you because here I'm gonna talk about the major 5 subjects of which people are super scared about. Firstly, let's talk about PSM. This is one subject which is so long and you need to keep revising it again and again, and believe me, all these notes are almost half PSM. Even then I would usually mark 5 to 7 incorrect answers in my mock exams, and I might have made a lot of mistakes in the FMG exam as well. So coming to my source, I used nothing, no book apart from Dr. Vivek Jain sir's notes. His videos are super interesting. He makes PSM really easy, but yeah, then you need to keep revising it again and again, and yeah, that's it. More the questions that you do, you understand what subjects, what topics are important from PSM, and I think that will really help you out in the exam. So coming to medicine, this is one of the subjects that I dreaded the most, especially the cardiology section, because ECGs was something that was just out of my capabilities to even answer a question. But I studied from Dr. Deepak Marwa sir's lectures and from his personal YouTube account videos, and they were absolutely amazing. All his questions, all his revision sections were based on the questions that he would solve with us, and would tell us his mentality on how to solve questions, and then would ask us our mentality on how you solve this question, and it really made a difference. So one tip that I would want to give you is, do not miss out on his YouTube channel because that is amazing. So next, what I did to make my medicine short was that I would annotate whatever was extra, the treatments and everything in my first aid, and then kept revising it. That's it. That was my strategy, and yeah, I wrote all of the things that were difficult to remember in the exam. For example, the murmurs, I would just write it here. Yeah, that's it. That's all I did. I practiced a lot of questions to make my medicine strong. It is one of the subjects where I would score very less, and so I tried doing the questions again from his YouTube channel, the Q bank that was present in Prep Ladder, and yeah, that's it. That's all I did. And of course the previous year questions, which I cannot miss at all. And yes, before I miss out, another amazing faculty is Dr. Rakesh Nair, and his medicine is very easy to understand, thorough, and just amazing. So I would suggest you, if you already have that as your resource, do not change it. He is also amazing. I studied tuberculosis and pneumonia from his topics. For surgery, I studied surgery from Bailey's. I referenced few parts from Bailey's, and then I came to Rohan Khandelwal sir's main marrow videos and made a base. I understood what is important, what is being asked a lot, and made a proper base. I studied it thoroughly, all the main sir's videos from marrow. But then my main aim for surgery was that I wanted to revise surgery for my FMG exam in half a day. So what I did was that I made all the notes so short, so concise, that this is my 20th notebook, and it has a lot of subjects in it, but I'll show you a little bit of my surgery notes. This is like around just around, yeah, so around these many pages. I hope that it is clear in the camera. These many pages were for surgery, and I made it like in around 20 pages. I just wrote down what I would usually forget and what is being asked in the exam. For example, the pelvic fractures, the urinary bladder fractures, they were being asked a lot. So I put that in my notes that were short but high yield, and I hope that you guys do that as well. For the images, I again refer to Dr. Rohan Khandelwal sir's YouTube channel, where he has this whole video of all the instruments, all the images that are important in the FMG exam, and you can easily reference that. Coming to pediatrics, a lot of people think that is the big 5 subjects. For me, it is a very small subject. I skipped the whole systemic pediatrics part and only studied the general pediatrics part. Somewhere here in the background, there is just 4 pages where I wrote whole the general pediatrics that is being asked in the exam. And this is what you need to do. You need to be very smart and understand that you need to make your notes short for your FMG preparation so that you can study it in the last 10 days. Courtesy Dr. Aditya sir and from AIMS, and he really advised me to follow this strategy to study all the subjects in the last 10 days, and that is what I did. I made my notes so short that I could easily do that in the last 10 days. Sorry, thoda bhatak gaye, but yeah, coming back to pediatrics, I used Dr. Singaram's notes and his videos from Marrow, and they were absolutely amazing. But if you already have another source, just stick to that. The last subject is OBGYN. For OBGYN, I studied it from Dr. Sakshi Arora ma'am's videos and her notes, her YouTube videos, her previous year questions discussion, and they were absolutely amazing. They helped me clear all my concepts in OBGYN, and because of her, my OBGYN became so strong that it was one of my high scoring subjects. So a big thanks to her, and you can also remember to check her YouTube channel for all the instruments and all the images that are being asked in the FMG exam. That is quite high-end and important. You can easily take out the PDF and keep revising it from your iPad or your laptop, whatever you have. And yeah, that's it. I think we have completed all the subjects, whatever sources I used, some of the techniques, the tips that I gave, and I hope that it really helps you out in your FMG exam. Remember to always believe in yourself, believe in your source, and you will nail it. Thank you all so much for listening till the end, and I hope my videos will be helpful for in your FMG journey. And yeah, that's it. If you have not watched part 1, the preclinical subjects, and part 2, the high yield and short subjects and the intermediate subjects, then that is part 2, and this is the last part. I hope it really helps you out. Go give your best in the exam. Bye.